Hello, everybody, and welcome once again to Functional Medicine with me, Dr. Howard Robbins. And as you heard, this show is dedicated to giving you safe, that's important, safe and effective, as well as healthy ways of overcoming all sorts of medical problems. And of course, I dedicate each show to just one disease or condition or whatever it is that, like, for example, supplements that we talk about. And this gives you an in-depth understanding of it. We have many people who contact me from around the world telling me they've been listening to all the past shows. Here's the thing. Most people will listen to the show that matters to them based on the medical problem they're suffering from. This isn't a medical news journal show, where I just talk about all the latest things that are going on in research that's happening and in health. I'm not a news show. We dedicate ourselves into helping you overcome things that normally often there is no other answer for, and yet we have been able to find and affect what you could say very often is a cure. Sometimes you don't know if you cured something. The reason being, if you don't know what the cause is, how can you test to see if it's really gone permanently, completely, once and for all, which is another way of saying cure. But if you don't have a way of proving it with some sort of a test, it's, in front of a judge and a jury, you'd have a hard time proving you cured it. The way I look at it is, if I treat somebody and they never come back again, and their problem is completely gone when we stop treating them, probably cured them. Certainly, if their symptoms went away completely, like in the subject we're going to talk about today, and they never come back again. You would imagine if they went away completely and the symptoms did come back, people would call me up again to say, "Hey, doc, I'm starting to feel it again. Can I come in and get some more care?" In which case, we just put something into remission. We never really eliminated it. But with the subject we're going to be talking about today, complex regional pain syndrome, originally known as reflex sympathetic dystrophy. Now it's called not RSD, but CRPS 1 and 2. Although many people still recognize it as RSD. We've probably the only one in the world that's ever gotten rid of it. But we're going to get into that in a couple of minutes. First, I always have to thank my sponsors. That's why I'm here. Not why I'm here, but that's how I'm able to afford to be here. All right. So first I have to thank, and this is very important, get pen and paper out now. Get your pen and paper together. You can put this on pause if you're not listening to it live, but you're going to want to write certain things down. Okay. One of the things that you're going to want to write down are the names of the contact information for my sponsors. Why? Because to a great degree, what my sponsors do can help get rid of this problem. Okay. So you can contact PromoLife, PROMOLIFE, promolife.com. You'll be able to get set up for home care ozone therapy. Now, home care ozone therapy hasn't been proven to eliminate this problem. It's only intravenous ozone therapy that has, as you're going to learn about it. But it certainly may improve it. And if you don't live in a place where you can get the method of intravenous ozone therapy that we're going to talk about, at least if you can do home care, it may help. So you would contact them at promolife.com. That's PROMOLIFE.com. And the benefit of their home care ozone machines is that they can be used anywhere in the world. And we're heard in almost 80 countries. So it's it's usable virtually in any country you want to go. You want to use it in. You tell them where you live, and because of the way the machine is constructed and the power supply, it makes it so you can just, with an adapter, plug it in anywhere. And if you tell them you heard about it here on Dr. Howard's show, on my show, they'll do something special for you. They'll give you a % off, or they'll throw a regulator in. Um, if you're in Germany, they call them pressure reducers in Germany, in Europe, in parts of the world. They'll do something special for you if you just tell them you heard about it on the show. And you can call them at 888-742-3404. That's a toll-free number, probably usable from anywhere in the world. 888-742-3404. And remember to tell them you heard about it here on our show. Next, as you're going to learn how the importance of probiotics, microbiome in the treatment of pain, anywhere of any kind in your body. So absolutely, you want to go to doctorsbiome.com, doctorsbiome.com, doctorsbiome.com. Okay. And what you're going to learn, or what you should know, and we'll talk about later, is why capsule powders and tablets are virtually completely destroyed in your stomach, and why Doctor's Biome is a living liquid probiotic beverage, 15 patented strains, living and growing in number every day, all right, in a 100% biologique, a 100% organic mint, kale, lettuce, cucumber, celery, apple, lemon juice. It's delicious. Children love it, so children can take it. And it's been created. They're all next generation, okay? Next generation probiotics. Next generation bacteria are created to survive the stomach acids and bile salts, where capsule powders and tablets are virtually completely destroyed, even if they do come to life out of suspended animation, because they are in a freeze-dried state, and many of them have already been destroyed. And then at the same time, they're also Doctor's Biome, those proprietary patented strains are also called smart probiotics. They didn't go to Harvard or Yale and graduate. They're actually created to stick to the wall of your gut. So they don't just aid digestion, okay, which is what you're going to get out of kefir, and maybe you'll get it out of kombucha, although kombucha has alcohol and sugar in it. This doesn't. Or maybe from sauerkraut or stuff, something like that, yogurt. Basically, they aid digestion, but they don't stick to the wall of the gut where you need them the most. Doctor's Biome has been created to do so. So if you go to doctorsbiome.com and you put in the code at checkout, the coupon code radio20, you'll get 20% off your first order. And you're going to want to keep using it. So go on auto ship. Not only will you get proprietary, when they, because it's being sold all over the world. Nutrimed, Nutrimed, is a company in the EU that's selling it all over the EU. You can go to their website, Nutrimed, and it's also being sold in Southeast Asia as well. So it's being sold virtually everywhere. It can be shipped everywhere, though you got to pay extra shipping if you're not in the continental US. Otherwise, it's free shipping. And it's a 100% money back guarantee. It's an amazing product. And you're going to learn why it's so important, because the gut communicates with every organ and every system in your body. Okay, spend enough time with this preamble. Let's get into things. This show is a show that virtually can affect every single person in the world. Fortunately, it's not common, nor is it uncommon. I have an expression that I use when I deal with conditions like this. I call it uncommonly common. The claim is about 200,000. If you go to the NIH, About 200,000 people here in the USA have it. If you do the math and you check on how many people worldwide, um, it can go into the millions. And it's very possible because we have 7.9 billion people in the world. And this affects don't ask me how they come up with these numbers, but 5.5 to 26.2 out of every 100,000 people. That means you can have hundreds and hundreds of thousands, possibly, I think, as much as about 8 million people worldwide might be affected by it. And it often is not diagnosed correctly. You just have pain. But let's talk about it so you'll understand what it is. This is a severe pain. I'm talking about like pain like you could never imagine. Um, um, and it's chronic. It doesn't just generally go away. It's possible that it'll go away, but not quickly. And some people have to live with it literally for the rest of their life. You have an injury. You're in an auto accident. You take a fall. Something falls and hits you, your arm or your leg. You might have a stroke or a heart attack, or you might have surgery. Suddenly, after you should have recovered, pain, way out of proportion to the severity of the initial injury, starts to develop. Now, it can develop where it only affects one segment of your body. That's why it's called complex regional pain syndrome. Originally, it was called Reflex Sympathetic Dystrophy, RSD. And they have no clue as to why this happens, but we're going to talk about all that now. But basically speaking, and by the way, I'm published on this. I'm published on it in 2019 because apparently I'm the only one in the world that's ever gotten rid of it in people. So we published a paper called Ozone Therapy for Complex Regional Pain Syndrome, Review and Case Report. It was published on May 6th of 2019 in Current Pain Headache. Okay, Current Pain and Headache. And so you can get a copy of it. It's from Springer, very good medical publisher. And it's very well written by my buddy, Dr. Robert Rowan, out in Santa Rosa, California. He's a great writer. Even though it was all my patients and we collaborated, I just love the way he writes. And I asked him if he would write this one with me. So when you get this painful condition, it can affect one limb, one arm, one leg, or it can start in one area and spread throughout your entire body. I mean, you ever get brain freeze when you drink something ice cold? You ever get brain freeze? You know what I'm talking about. Almost everybody has had it when they eat or drink something very cold. It lasts for a few seconds, and boy, does it hurt. Imagine waking up with that kind of a headache, or sometime during the day, that kind of pain develops in your head, and it doesn't go away for several hours. One of my patients that I treated successfully for this had to suffer this for several years, okay, every day till she discovered this. And let me tell you how I got involved in this, and then we're going to because we're coming up to commercial break in just a few minutes. So way back, I think it was around 2017 or something like that, I got a call from a woman who does a podcast for an RSD support group. Podcasts weren't all that big back then. And she asked me, would you like to be on the show? I said, certainly, because she's always looking for guests. And, ozone has been used to treat many different things. And, I'm the ozone man, that's for sure. One of the big names apparently in the world. And I say that with humility. even if it doesn't sound like I'm being humble. And so I said, I'd be happy to go on. And then I did research and I found out that nobody that has ever published on ozone, and believe me, there's hundreds and hundreds of papers, has ever treated it, nor was it on any list of things that ozone has been used to treat at all, let alone even unsuccessfully, let alone successfully. So I called her back to tell her, I'm happy to be on, but I don't know if it can help at all. What I do can help at all. She said, let's talk about it anyway. And what I decided to do was offer a couple of people to come in. I would treat them for free to see if it would work. It worked. It was a breakthrough for people with CRPS. And both of these people that came in, and now I've had 3 patients, 3 or maybe it's 4. One wasn't certain, but I believe it's 4 patients now over the years, and completely eliminated their pain. It was a miracle, just literally a miracle. So actually what happened was 2 people came in that got it for free, and I had 2 people over the years since then that paid for the care. I don't do while everybody knows that I do pro bono work, I treat 1 out of every 5 patients for free. There's no such thing as free. My pro bono list, by the way, don't start calling up and wanting to get and free care. You're welcome to call up and speak with me, but the pro bono list is like a yard long in number 2 font with names and phone numbers, and I treat everybody one at a time. Because 1 out of 5 patients, that is, at a time, until they're well. So it could be 1, 2, 3, 4, 5 years sometimes before I can call the next number on the list. Usually 2 to 3 years, because most of what I do is S&S, safe but slow. Keep in mind, pharmaceutical medicine is F&D, fast and dangerous. And unfortunately for CRPS, all they have is painkiller. Most of these people are on fentanyl patches and taking narcotic painkiller, oxycodone, whatever, like candy. And of course, after a few weeks, that stuff doesn't even work. Now you're just addicted. Now you're just addicted to that. So let's go to our first commercial break. Then when we come back, we're going to get into a little bit more about the signs and symptoms and what this is all about. For those of you who already know what it is, it's just going to be, oh, yeah, I'm living with it. And then we're going to talk about how you can get rid of it. First of all, nobody really knows what the cause is other than the fact of what initiates this painful condition. If you go onto the NIH or Mayo Clinic or Cleveland Clinic and you start to look this stuff up, you'll find that there's basically what you're going to get is that it's thought that the nerves on the injured part of your body are much more sensitive than normal, and that normal pain pathways between that part of your body and the brain may have changed so that the pain continues long after the original injury has actually really healed. Fact of the matter is, I just said something that actually has no great meaning because it doesn't really explain why this happened. They don't know. Doctors are embarrassed to say, gee, I don't know. I don't know are 3 words doctors should use far more often, because all they like to do is pretend that they know everything. And the one thing I've learned, this is my 50th year in medical practice, every year I learn more and more and I know less and less. It's hard. It's hard to admit it, but it's true. There's so much more to learn, and there's so much more that we're going to know as research goes on and as technology increases in years to come. But there's different signs and symptoms that come along with this particular thing. You get a continuous burning and throbbing pain. And again, it can be just one area of your body, a hand or a foot, an arm or a leg, or literally your whole body. Okay. There's a sensitivity to touch, often a sensitivity to cold. In fact, the areas often feels very cold, which is different from inflammatory processes where there's generally heat involved. Okay. There can be swelling of that area that was injured. Sometimes the area that was injured, or the limb, or even the whole body, can be sweaty all the time or suddenly get cold and stay cold. You can have changes in skin color. You can go from white to blotchy or red, or even blue. And if you're dark skinned, it's just going to mean darker coloration, or blotchy dark coloration, and then it can lighten back up to your normal color. Skin feels very tender sometimes to the touch. It may be shiny in the area that was involved. The skin may actually become thinner. There's going to be a change in hair and nail growth if it's on a hand or a foot, or even in your head. You may get joint stiffness, swelling. You can get muscle spasms. Like this one young girl that I treated, an 11-year-old, tremors. She actually had seizures that took place. Muscle weakness, muscle atrophy, along with the muscle spasms, can start to take place. And these symptoms can change over time, and not everybody has the same ones. You don't have to have all those things that I said. You only have to have a few. But hypersensitivity, pain, everybody has that kind of situation. Now, muscle can waste, can start wasting away. Even not just the skin and your muscles may deteriorate, but even bones can start, according to the experts on this, deteriorate and weaken because you're not moving them. So calcium is going to come out of the bone. You can get contractures. Okay. It might go away over time, but in most people, it doesn't. That's the problem. Now, keep in mind, the world we live in, we're facing a crisis in pain management. Pharmaceuticals, basically, you're using morphine, oxycodone, fentanyl. All these things come with addictive risks. This isn't an aspirin type of pain. This isn't an ibuprofen type of pain. Okay. This isn't Tylenol, that acetaminophen that's going to work. This is such severe pain, you will have to go on one of these narcotic-like painkillers, these class 2 painkillers. And the problem is you don't want to come off of them. Now, if you're with a pain management doctor knows that after 2 weeks of using these things, you're addicted. And now you got a real problem, because you're not only in severe pain, and the only way to seem to possibly manage it is to take these very potent painkillers. But what else can you do, even though you know you're addicted to it? Well, there are things that you can do. There are things that you can do. And that's what we're going to start talking about right now. First of all, ozone therapy. Now, we do direct intravenous ozone therapy, Robin's method of DIV, direct intravenous ozone therapy, as it's called. This is where we inject oxygen and ozone gas directly into your veins. It's not obviously not dangerous, or I wouldn't be speaking to you, because when done correctly by a trained healthcare professional, just in the last 4 weeks, I trained 4 different doctors, 2 from Toronto, 1 from California, and 1 from Pennsylvania. So many doctors around the world now do intravenous ozone therapy, but there are different methods, and they're all not created equal. The only method that's ever been shown beneficial against this is the direct IV method, using my method, my protocols, Robin's protocols for direct intravenous ozone, where and I've done it 368,000 times as of the date that, or actually almost 369,000 now, as of the date of this show when it's being first aired. So we've proven not only its benefits for many different things, if you listen to some of the shows, but certainly for this problem, we've proven its benefits and its safety. And we take in our clinic, Dr. Do No Harm very, very seriously. New York State would shut me down if I hurt one person. So we take Dr. Do No Harm very seriously. Fact is, you're in such pain, I can only benefit you. Certainly no moral and ethical doctor should ever promise or guarantee a result. Even if you're successful, 10,000 patients in a row, you never know what's going to happen on 10,001 for some reason. But truth of the matter is, when done correctly by trained healthcare professionals in my method, and using my protocols, I expect you're going to get results. Simple as that. Why? Well, ozone, and remember, if you listen to the show called Intravenous Ozone Therapy, everything you need to know, there's about 7 different intravenous methods of ozone therapy, but you got to use the right one. If you don't understand what I just said, because some people think it's all the same, if you have an automobile that requires diesel fuel and you put gasoline in it, go try to start it. If you have a car that runs on gasoline and you put diesel fuel in it, go try to start it. If you don't get that, many of you who are listening to the show may have had an antibiotic. Sometimes antibiotics don't work. They have to switch to a different one. They're all not created equal. So while people will say, well, I did ozone therapy before and it didn't work. Yeah, you did the wrong method. And then if you're not using the right protocols, the right amount of gas, the right concentration, the right frequency of it, along with certain other things we're going to be talking about on this show, that's why it's called Robin's method, you're not going to get the same results. You have to duplicate what we have done to get duplicable results. Otherwise, you're going to say, well, it didn't work for me. Okay. And that's unfortunate. All right. Well, ozone has certain mechanisms, which is very beneficial to help reduce chronic pain and inflammation and hypoxia. That means a lack of oxygen to an area. It has inflammatory mediators. It's anti-infective, because sometimes infections may be causing this for all we know. So it acts as a painkiller and an anti-inflammatory, but it has circulation benefits as well. It makes the red blood cells flow smoother, easier, and less viscous because it makes them rounder. It makes them more flexible so they can slip through narrow, clogged, and hardened arteries better. Now, when you have an injury, there's swelling, and the swelling stops blood flow in and out. This may cause some unusual inflammation and irritation to nerve tissue there, and nerves are not like a light switch. Anybody that's ever had a pain understands that. When you get smacked in the head or something, or you take a fall, you injure a part of your body, you have a surgery, you're in an accident, The pain just doesn't go away instantly like a light switch on and off. Hopefully, it goes away and bit by bit it diminishes and you start to feel better, like a dimmer switch on a light. Then one day you wake up, pain's gone. Okay. I wish pain, because nerves don't instantly deflame. And when they are inflamed, when they're being pressed on by by swelling and whatnot, it's going to hurt. That's what pain is all about. So, um, and it's a simple therapy. Little, you put a tourniquet on, and it has. And now here's the thing: people don't understand. If this is so great, why haven't I heard of it before? It's not a patentable medicine. It's made in a medical ozone generator from medical grade oxygen at that moment you need it. It is not a storable medicine. Okay. It's not a storable medicine. If it were patentable, which it's not, only the generators to some degree have some patentability. But for the most part, it's virtually not a patentable medicine. It's elemental for that matter. It's made from oxygen, O2, but it's the extra O that does all the work. If it were patentable, it'd probably be in every hospital today because Big Pharma would be interested in it. In fact, Big Pharma won't be interested in it and doesn't like it because it helps eliminate the need for many different types of pharmaceuticals. It's not new. So listen to the show on intravenous ozone therapy, everything you need to know, and you'll get more details about that. I don't want to waste our time on that on this show. Now, there have been many different treatments for CRPS. You can, some of them besides the painkillers, they tried hyperbaric oxygen chambers. There's been one report that it had benefit. Why? Because it compresses the oxygen if you're in a real chamber, not these one-person torpedo tubes, but if you're in a real hyperbaric chamber like you see in the movies where they wheel gurneys in for for burn victims. When you're in those kind of chambers, then you can really compress the oxygen in the blood to create the chemicals that when we inject ozone directly and oxygen directly into your blood are created by your body immediately. What we call reactive oxygen species as well as lipid oxidation products. Alkenes, alkanes, peroxides, peroxyls, super-O anions, all sorts of things that last only for a couple of hours. But what they're doing is reducing the inflammation and thus reducing the pain, allowing the nerves to heal. That is the least that we could figure out as to what's going on. Okay. But there have been many different things that have been tried to be used. Surgical ablation, corticosteroids, prednisone, which is as dangerous as any pharmaceutical can get. Nerve blocks, sympathetic nerve blocks, bisphosphonates, DMSO. They've tried amputation. I think I'm kidding you. They've tried amputating the limb to stop it, hopefully, from hurting the entire body. When it's, they've used botulinum toxin. Of course, as I said before, most drugs have virtually no benefit and no effect. But the hyperbaric oxygen therapy, at least in one study, did show some benefits, which is what I found and why I believed intravenous ozone might just actually work. Now, here we have a girl. She's 11 years old. She's walking around the track in elementary school, middle school, whichever she was in at that point. I think it was middle school. And her knee started to hurt. Well, the knee pain didn't go away. They brought it to an orthopedic surgeon. couldn't figure out why the knee was hurting, and then it started to spread till her whole body was aching, and you can't even imagine how this poor girl started to walk in pain. And then she started having convulsions, 25 to 30 a day. She started in September of one year. I got her on the Wednesday after Thanksgiving here in the US. And within just a few weeks, we knocked it down to under 25 convulsions a day. Within a few months, she started to have only 5 to 10 convulsions a week. And by the following September, she was virtually fine. We have videos on all this. This isn't just stuff I make up. I'm going to tell you about another case. She went back to school and she's been fine ever since. And she had been diagnosed with complex regional pain syndrome and pseudo seizures. Let me tell you about another patient. And I have videos on that, and I've presented on this subject at various medical meetings around the world because, like I say, nobody else has ever cured it. There's another patient that we didn't put into that paper. You can actually get it if it's possible to still find it somewhere through the internet. A documentary was done called Ozone Therapy, The Miracle Medicine by Gary Knoll, PhD. And in that, you'll see me, a couple of other doctors that he got to come on, and you'll see about 40 some patients in different diseases and conditions. And they were all my patients, just so you should know that he filmed for this. Now, there was this one woman, Kathy, that you'll see on there. And Kathy is an RN, and she went in for a surgery. She had a fatty tumor around the nerve in her foot called a neuroma. So she went in for neuroma surgery, and this should heal, right? Pretty much, 6 weeks, it should have been fine. It wasn't. She started to develop, then it was called RSD. She started to develop the pain in the foot, and it spread until it was whole body. She's the one that I was talking about, where every day for 2 hours, she would get brain freeze. She didn't know what to do. And you'll hear her talk about how she was on fentanyl patches and taking oxycodone and all these different pharmaceuticals, and she had no hope. One of the problems with this medical problem is that about 15% of the people that get it commit suicide. You heard me right. When you wake up every single day and it's just this day after day from morning till you're able to fall asleep, if you're able to fall asleep, nothing but continuous severe pain, and nothing is helping or barely controlling it, you become depressed. It's very common to have depression, anxiety. Oh God. I mean, the symptoms that come along with it, it's sad. And thinking about suicide is not an uncommon thing. They've done studies that show that almost 50% of the people that get this at one point or another have considered suicide. Only about 15% actually do it. So think about it. People, I gave you numbers before at the beginning of the show. People are killing themselves over this. I'm not kidding. That's why I decided to do this show. So, bottom of it all, intravenous ozone therapy is going to work. Now, here's the good news. You don't get instantaneous results necessarily, but if you stay with it, and it can take several months, you will see improvement. You have to do a minimum of 3 treatments a week. Ideally, you would get it 5 or 6 days a week. It only takes 2 to 6 minutes to do the therapy. It's fast. It's easy. And with my method, you could use little bitty baby veins. because we're using a very, 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 very small needle. It is not a painful therapy in any way. You're in enough pain. We don't have to give you any more. There's virtually no adverse effects from it. Listen to me. There are virtually no adverse effects from it. Okay. But you have to be prepared for the therapy. And this is part of why I was successful in healing this. One, you have to be well hydrated. How can you have an effective organ? Our body is over 70+% water. So you can't have things work right and heal correctly if you're dehydrated. So all the patients have to drink 3 to 4 liters of water a day. Secondly, vitamin C. Vitamin C is not just a vitamin. Vitamin C is also like a coenzyme, like CoQ10. All right. Basically, if you look and understand the chemistry, it's necessary for virtually every healthy cellular reaction. It helps make it happen, okay, including making energy. So the ATP molecules. So you need to be you need to have enough vitamin C in you. And we recommend that people, and all my patients take vitamin C orally, anywhere from 1 to 3,000, 500 even, but up to 3,000 milligrams. Listen to this, every 2 hours while they're awake. That means 5 or 6 doses a day, not just once or twice. Because if you have a high quality vitamin C, and we've done shows on vitamin C, so listen to those shows if you don't know what is high quality. But if you have a high quality vitamin C, obviously not GMO'd or anything else as a source where it was made from, it will be highly bioabsorbable. That means it goes from your intestine into your gut, from your gut into your blood. Then it's going to be highly bioavailable. That means your cells will be able to uptake it. And then it's going to be highly utilizable by your body. So you need to do that. And then last but not least, and I mean very much not least, you have to repair your gut, because the gut connects to everything. The gut connects to everything. Literally, if you go on the internet to our National Library of Medicine, pubmed.gov, and put in probiotics and the nervous system, probiotics and pain, you're going to start to see how the gut interacts, how your gut impacts the nervous system in your body. There's not one paper, there are many of them, okay? And they explain how the gut influences the secretion of cytokines and exosomes and all sorts of things in the body that help in the mediation and control of pain, all right? How it helps reduce inflammation in the body. The gut bacteria communicate with everything, absolutely everything, okay? So there's not just one paper, but there's many papers. I have things in front of me, the gut microbiota and the peripheral nervous system. Chemotherapy-induced peripheral neuropathy and how the gut microbiome fixes that. And on and on and on. The nervous system is directly connected to your gut, believe it or not. So you need to go to Doctor's Biome and start taking it. As I said earlier, these bacteria are capable of populating the wall of your gut. Gets yeast in balance again. It helps get rid of bad bacteria that are living there. And the most important thing is they can survive. Okay, they're made to be shelf stable. That means they don't require refrigeration. Refrigerated just slows the growth down. And meaning how, they make babies in the bottle because the food they need, the prebiotic, is in there. And why it's called a symbiotic, that means it has prebiotic and probiotic in it, and is because by having both and by actually giving you a health benefit, okay, it can be called a probiotic slash symbiotic. Because otherwise, if it doesn't give you a health benefit, they may want to call it a probiotic, but it isn't. It has to confer, by definition, a health benefit on the host, which is you. And if you go to doctorsbiome.com, doctorsbiome.com, and you put the code radio20 in, you'll get 20% off your first order. The way to keep getting it at a discount is you go on auto ship. But let me get back to, so by repairing the gut wall, now you can absorb nutrients better and start getting your body working correctly again. Now, if you're at home, you're in a place where you can't get, you may have to travel. You may have to come to New York City to my office. If you have to reach me and you want to talk about this, you're welcome to call my office in Manhattan at 212-581-0101. That's 212-581-0101. Email me, ozonedoctor@yahoo.com. Ozone Doctor, OZONEDOCTOR, at Yahoo, YAHOO, yahoo.com. And I'm going to basically tell you to call me, or if you give me your number, I'll be happy to call you back, certainly if we're in the USA. If you're overseas, we can use WhatsApp. So you can give me your phone number. If you have WhatsApp, I'll call you back through WhatsApp, or you can call me through WhatsApp. So it won't cost you anything. I don't like to give my cell phone number out, but if you call my office, they will give you my cell phone number. So that's 212-581-0101. Now, if you go to Promo Life, you'll be able to get home care. You can get it. Tell them you want to get set up a la Dr. Robbins for home care. I don't make any money from it. Just in case you're wondering, do I get a kickback? They actually help sponsor my show. That's all. That's more than anyone could ask for, as far as I'm concerned. But bottom of it all is get yourself set up for home care, and you could be doing rectal insufflation. That's an ozone enema, and the ozone enema will put some of it into your blood. Now, is it going to get rid of RSD? I don't know, because nobody has ever used it to try to get rid of RSD, because you're not going to absorb as much. You'd have to burn a hole in your colon to try to get a hole in your gut with ozone, to try to get as much as I get into your blood with one treatment in our office. But bottom of it all is, this is you can get set up for home care by going to promolife.com and call them at 888-742-3404, 888-742-3404. Tell them you heard about it here on the show. They'll do something special for you. Now, this is a horrible, painful problem. Listen to me. It works. I treated 2 other people besides the 2 stories that I told you about, and we had nothing but success. So right now, 4 out of 4. 100% success rate. I don't know if I'll be as successful if I had 100 people to do it on. Maybe maybe we'd have a few failures. I can't imagine why. Why should it work 100% of the time? Statistically, this is amazing. You don't need 1 million people to statistically prove something is valuable. Everybody, I want you to if you know somebody, let them listen to this show. If you listen, like some people listen every week to my show, they stay on top of it. Keep it in mind. You're going to finally find there are people that have this that you may know. Basically, they're at home. They can't function. They can't go to work. They can't do anything. One way or another, everybody, thank you for listening. Stay healthy, stay well, and listen to our show next week. I have some great guests coming up. Going to be doing a show hopefully on water again. the latest on how to make healthy and why water is so important. You need purified water, etc. Have great. I have a dentist coming on, chiropractic coming on. We're going to hear some great shows coming up in the very near future. Everybody, stay healthy, stay well, and we'll be back again next week. Bye bye now.